at your growing group practice. I have the pleasure of introducing Brian Doyle, Senior Vice President at Rectangle Health. Welcome, Brian.
Thank you, and thank you for having me. I'm excited to be here.
Awesome. Thank you for being here. And Ali Oromchian, CEO of HR for Health. As always, Ali, welcome.
Thank you, Jennifer. Thank you. Excited to be doing this with Brian today. So thanks for hosting us.
Yes, of course. Thank you, guys. So we're going to learn how technology is helping practices get more done with much less effort, from automating patient payments to digitizing patient communications and keeping schedules full without even picking up the phone, which, being in a dental office a lot of my life, that sounds amazing. So excited to hear about that. So without any further ado, I'm going to turn it over to Ali, and then at the end, if we have any questions, I'll be sure to get to those for everyone as well. So Ali, please take it away.
Perfect. Thank you, Jennifer. Brian, it's great to see you. I know I see you at all these events and whatnot, but it's great to have you here on the webinar.
No, yeah, thanks for having me. You guys have been fantastic to work with over the years, so I'm excited you and I could actually sit and talk and put this out there for everyone to listen to.
Exactly. I know. When we're at these events, especially the group events and the DSO events, it's so hectic all the time. We don't really get a chance to catch up. So let's jump into it, because I think, Rectangle Health's, focus on the DSO and group sort of market has sort of spoken for itself. But, from our clients' experiences and the feedback we've received, they love your solution. But tell us a little bit about the company in your own words, and then also your role at Rectangle Health.
Sure. Yeah, absolutely. Believe it or not, we're a 30-year-old company. We've been around 30 years, so we're coming up on 30-year anniversary this year. Our company history is pretty cool, and I've been lucky enough to be here for 13 years, so I'll kind of touch on that in a minute. But we started back in the 90s selling merchant services to dentists. That's essentially what we did. Back then, it was a terminal, and it was innovative, and it was cutting edge because no one took credit cards. Then we started to see, and we actually had office managers used to tell us, hey, I don't get paid. Insurance covers and we don't get paid. So then we started talking about card on file. We were talking about card on file back before it was ever even thought about. Fast forward a few years, in 2012, we started transitioning to more of a software company. From there, our growth absolutely exploded. So 2017, we took on our first round of funding. 2021, we took on a larger round of private equity funding. And since that time, our solution is no longer just payments. We're really good at it, and we still are the incumbent payment company in dental, and we're pretty proud of that. But we've expanded our solution to incorporate the entire patient journey. So we want to be that one-stop shop. We want to be everything outside of the PM system. We're never going to be a PM system. We're not. We want to be that second vendor that provides absolutely everything a front office needs, a back office needs, and more importantly, what the patient needs. So we have built out our solution to go up market to our DSOs, which we're very proud of how many we have today. But our core business has and always was SMB, direct to provider, Dr. Smith, one office, one operatory, one office manager practices. We still have thousands, tens of thousands of those. So we're proud of how our solution has been able to scale up market and down market. And over the course of the last 12 months specifically, we have very carefully thought out what our solution needs to have that it didn't. And we put that out there to our current customers, to current partners. So we're thinking about things like compliance and financing and engagement and scheduling and all this other stuff that we're providing our offices today. And then my role, staffing is actually a kind of cool topic for me to talk about. I was a boots on the ground street rep for years in Chicago. I lived there. That's what I did. I talked to Dr. Smith and Dr. Jones, and then on and on and on for years, for about 8 years. From there, our company, we said, hey, this DSO thing's starting to take off. So I said, hey, I want to do that. That sounds pretty fun. And then they entered me into enterprise. And then over the last 3 or 4 years, I now run the enterprise channel and our SMB channel. So I have the privilege of working with our amazing sales team, our amazing resources, our amazing marketing team. So right now, I do run the entire direct sales channel at Rectangle.
Awesome, wonderful. Yeah, and that is quite the history. I had no idea, you guys started in merchant services, but more importantly, that you've been doing it for 30 years. I mean, that's a long time. So
it's a long time.
A long time. And obviously, any business, it doesn't have to be in dental, but any business, I mean, cash flow is king, of course, and you guys have been at the heart of that payment processing from the very beginning, it sounds like. So it makes sense what you're doing. But and I want to talk more about that bridge that you are providing, I guess, between the practice and the patients. But before we jump into that, Brian, I want to discuss the staffing challenges that we're all seeing in the industry. I always say the dentistry has 100% employment, which basically means anybody that has any dental experience, if they want a job in dental, they can get one, because almost everyone's hiring right now. And so, recruitment is always a challenge. And we've seen a whole bunch of offices, focus on providing better benefits, whether it's like 401ks or health insurance. They sometimes increase compensation. But I'd love to hear your perspective on that. Being boots on the ground, working as much as you do, with groups and DSOs, from your clients in this dental space, what are your recommendations for them overcoming these challenges? And I guess even before your recommendations, maybe you can tell us, like, what are you hearing, from them, just on purely staffing and recruitment?
Yeah, so what we're hearing is burnout, right? That's the term that I think everyone's talking about. Where we, the providers, are trying to do a lot with less FTEs, with less headcount, which is a problem. So what we're seeing, and what we have been seeing over the course of the last, 5 years, specifically with technology, the dental industry has been amazing at getting paid by payers, because that was 80–90% of revenues. However, patient payments, what the patient owes, and this is never going to go down because premiums are going up, deductibles are going up. It's 36% of revenues today, give or take, depending on the vertical. But it's 36% of dental payments today, or dental revenues. So that what used to be a $20 copay might be $150. We can't write those off anymore. We have to collect that money. So what happened is we got so good in the dental industry by figuring out how to get the best payer monies and the best options there, that we kind of forgot about everything else. So what we're hearing and what we're seeing specifically in the DSOs is, hey, we don't have the headcount. We can't collect this money, or it's so manual, or it's so FTE centric that either we have John or Debbie doing all the billing, and then someone else doing all the calling, and then whatever gets to their agenda for that day, it gets done. If it doesn't, it gets pushed off. So inevitably our AR is starting to pile up. Our backlog is starting to pile up. So what happened now in the course of the last 2 years is so many vendors came into market saying, hey, we can help, we can help, we can help, and they can. There's a lot of amazing vendors out there. It's actually really cool to see some of this technology. So please reach out to vendors. They are trying to help. Shameless plug there. But what we're seeing is the need for automation. We have to automate because we don't have the people to do it anymore. So when we think about dental, one of the biggest pain points is and always will be post-adjudication. Patients owe us money. I need to get paid now. We can automate that. We, meaning the technology in the industry, can automate that. So we saw a significant change really from COVID, so like March of 2020. It was clear and concise, the change. The consumers, like you and me, if we make a reservation on Open Table, card on file. It's mandatory, have to do it. If you make a barber appointment, if you take your dog to get groomed, card on file. So we saw the consumerization of healthcare come flooding in 2020. Thankfully, we've been building out, we've been selling, like I said, card on file since the 90s, right? So thankfully we were prepared for this, but the biggest change we're seeing today is the need for automation, and that the patients are saying, hey, we need this technology. They're actually shopping their experience based off the technology that the clinics are offering. So Technology is forefront to helping solve the staffing issue, but more importantly, eliminating burnout. Because if we can automate a lot of what the office manager is designed to do, he or she can concentrate on taking care of their patients, which is what we are trying to do at the end of the day in healthcare. So automation to save time to treat patients.
Yeah, yeah, and it's interesting what you're saying about automation, because I think sometimes people hear automation and they think, oh, there's less human contact there, so it's going to lose that personal touch and that feeling. But I agree with you. It's actually the exact opposite, right? It's the hurdle to get in, the hurdle to change an appointment, the hurdle to pay, all those things they don't become hurdles anymore. Suddenly, it's just easy for the patient to do that. And it's funny you bring up Open Table, because I use it all the time, and it's so incredibly easy, as opposed to calling these these restaurants and trying to make a reservation and this and that. It's like, it just makes life easier. And for busy people, and this is our society now, everyone's busy, or they're just kind of wanting to do things quickly, even if they're not busy.
That's right.
They want to get back to their Instagram, or whatever. But that automation helps a lot. And two, something that I saw at our leadership summit in Nashville that I know you were at, and it was very interesting, because the feedback we got regarding some of the content was really interesting, in the sense that people would come up to me and say, I love this segment, because it tells me, or has shown me, that I can rely on my team to do things, but I don't necessarily need to rely on that individual person. So in other words, I can create systems where I can make their job easier and they can provide the best to my patients. But if that person leaves or retires or whatever, my system is still there.
That's right.
And I can plug someone else in.
Absolutely, yeah. And you touched on the beginning there about automation. The feedback used to be, well, that means we have to cut headcount, or people will take people's jobs away. No. So I try to use analogies as much as I can. I'm overdue for my dentist appointment. I am, but I've called 3 times. Yeah. I can't see the live schedule. I travel a lot for work. I can't get in there right now. So I'm missing my appointment. I want to go back. I can't schedule online. I forget to call. It's 9 p.m. I don't end up calling. Then my wife got a bill for $12.38.
Okay.
We tried to pay online, no online bill pay. So when we talk about automation, it's not take away people's roles. It's to give me and my wife and our patients a better experience, because we want to come back and we are good payers, but I don't want to call over the phone, and I'm not writing a check. I don't even know if I have checks, Ali, to be honest. So we need to automate. By automate, we just mean easy ways to pay that we use every day in our retail experience. Amazon is Amazon for a reason. Yeah. You go in, you click, and it shows up. If you have to put your credit card in every time you went on Amazon, their revenues would decrease substantially.
Yeah, no, that's exactly right. That's exactly right. And it's funny, to give another example for many of you out who are listening to this, and this is something that is not necessarily focused on, but it goes back to automation. And this is where I think dentistry and Rectangle Health has definitely done this. HR for Health has done this, which is we take lessons from the sort of Fortune 1000 and the non-healthcare industries and apply it to healthcare. And when we do that, we get all the benefits and none of the really drawbacks, because we know what works and what doesn't work, right? And it's funny. I read this thing this past weekend where the federal government wants to give Tesla $7.2 billion for them to open up their charging network to non-Tesla owners, right? And one of the interesting things about it is that it was talking about how simple it is for someone to go in and just plug in their car and drive off. They don't take a credit card, they don't take anything, they just go plug and they leave, right? And they want that same thing for the rest of the auto industry. Right. Well, to use that example, you want to be that Tesla in dentistry, in group. You want the patient experience to be so smooth that people just want to keep coming back and paying and doing whatever they need to do. you don't want to be that laggard who is the last practice in your city to bring on technology, because yes, you have to invest a little bit, you have to train your staff, you have to talk to people like Brian and our team at HR for Health, but at the end of the day, you're going to be better off.
No, yeah, the ROIs are clear and evident. I mean, we're talking about better collection rates, better patient loyalty, lower AR. I mean, the ROIs are through the roof. But it goes back to patient loyalty, because every study today, millennials and then younger, are shopping their healthcare experience, dental, medical, it doesn't matter, based off the technology those providers are offering. So if we don't offer scheduling online, or we're not offering financing options for a triple root canal, that patient's simply going to say, I'm going to go to Dr. Smith next door and get it there. They're not, it is not, the loyalty isn't what it used to be unless you have the technology.
Yeah, exactly. And by the way, for everyone who's listening too, remember this also applies to your team, because your team would prefer, I mean, they got into dental not to pick up the phone and help people take credit card numbers, right? They got into dental to help, people get better, dental health and be able to have their beautiful smile and have that patient experience be what they're hoping for. And so by putting this technology in place, you're also making their jobs just better.
100%.
And we all know if people feel like their jobs are better, they're doing more productive work as opposed to sort of menial work, they tend to stay because they feel challenged, right? And that's a big thing. I'm glad you brought that up, Brian, because a lot of feedback that we get from office managers or HR professionals in our groups say that some of the technology that we have at HR for Health has made people happier in what they're doing, because they don't have to worry about pushing paper and whatnot. And it's the same thing in your world. So, okay, so let's shift gears a little bit. You mentioned earlier that Rectangle Health's mission was to simplify the business side of healthcare, right?
Right.
And so let's talk more about that technology. So as practices implement the technology and these staffing challenges, let's talk about how specifically you do that by focusing on efficiency and productivity. Can you go into a little bit more detail about that?
Yeah, absolutely. The ultimate goal is that when a patient walks into the practice, they're already registered, they already submitted all their information, they simply walk in, they get treated, and they walk out. That's the ultimate vision. So our technology is designed to touch the customer experience what we call pre-care, before they walk in the door, in clinic, and then post-care, post-adjudication, billing, insurance, all of that. Our technology is to come in and say, hey, patient, we are on this thing all the time. I actually have 2 of them all the time. We want the patient to be able to drive their experience on their cell phones, or computers, of course, but want to drive their experience on their cell phone. So our ultimate goal is the patient comes in, gets treated, and leaves. During that time, the staff, all they need to do is treat the patient and make sure they're having the best possible patient experience they can. So when we talk about simplifying the business side of healthcare, that is what we mean. We don't necessarily need clipboards anymore. We don't need to go over bills, or we don't need to ask for, hey, can I have your credit card and hand it over? We want to automate that entire process. We want this to be frictionless and seamless for the patient. Going to the dentist should be and could be a very quick and easy healthcare visit. I'm in, I get my cleaning, I'm out. We want to eliminate all the friction. So we want to make it frictionless. We want to make it seamless. And that all starts before the patient even walks into the practice.
Cool. And Brian, not to get too technical, but share with our audience what kind of training and onboarding process looks like for the team, if they want to kind of transition to Rectangle Health. Like, what does that training look like? How do you guys take care of that?
Yeah, great question. So I know we use the term vendor a lot. We actually don't believe we're a vendor. We want to be a partner to our practice. So why I brought up where our company started is we started down market, SMB, 1 doctor, 1 office manager, 1 operatory. We had to build our software to accommodate them. Yeah, we scaled up to accommodate some of the largest DSOs in the country, there's no doubt. but the software itself needs to be intuitive and it needs to be easy to use, because we could say we have the best software out there, but if you can't use it, then it doesn't really matter. So what we've done on our end is we have a sales team, of course we do, but behind that is the bread and butter of what Rectangle Health does. We want to be a partner to an organization. So we provide dedicated customer success managers, dedicated project managers. We have all the collateral you need. We have the scripting if you ever ask us for it. We have all the signage. We have everything a provider would need, and it's all in product onboarding as well. So if there is a lot of staff turnover and we need to go through HIPAA training real quick, we simply click on a button and that new FTE goes through HIPAA training. So we make it so intuitive and provide the human resources behind it at no capital expenditure. No client is going to pay us to train their staff, because we believe the more a provider uses our software, the longer our relationship will be. So we want to be as involved as a provider will allow us. So we have an entire team, and they're the real MVPs of our company, that are hands-on with our clients every single day.
Oh, that's awesome. That's awesome. Yeah, I think when we talk about technology, kind of incorporating technology into a practice and bringing something new, it's always a little bit scary, right?
Yeah.
And sometimes team members are a little bit older, or they're used to like what they're doing in the practice and they don't want to change. But I love how you guys are hands-on in that, and the fact that there's no real extra cost for the office is a huge perk, because if they can onboard quickly and be able to push that out to their patients, all the better. So okay, last couple of questions. So for growing group practices and DSOs that are thinking about adding the technology, or maybe seeking a new vendor and kind of comparing different products, give some advice in terms of what their first step should be, as they're kind of going down this road.
Yeah, absolutely. One, get a itemized list of all the vendors you're using to do what you're looking to consolidate. Because as we know, if I'm going from 5 to 15 or 1 to 2, odds of me buying a practice that has the same PM, the same merchant vendor, the same scheduling, the same texting vendor, the same compliance is 0. You're going to have multiple vendors doing the exact same thing as you acquire, especially as you acquire fast. So the first thing to do is find out who those vendors are. Who do you like? Who don't you like? What is the margin? What is the pricing, etc. From there, you want to think about what vendor can we talk to that can eliminate as many of these other third parties as possible. Consolidation. The best way to put that is consolidation. The more you consolidate in technology, the better ROI you get, the less training there is. We, Rectangle Health, firmly wants to be the lifeblood of the office outside of the PM. There's other vendors that do this too. This is not, hey, call us only, we're the only ones that can do it. Absolutely not. There's a lot of really good vendors out there, but you have to talk to them. Definitely take a few meetings. The vendors are going to show you some really cool stuff. And then from that point, can you go to scale? Scale's the tricky part. Installing a 10 location group is hard. Installing a 100 location group is significantly difficult with not a lot of vendors that have done it. So can you install at scale with the same training, customer success, white glove service that we just talked about? That's the tricky part. So figure out who we're using, who's working, who's not, what vendors can consolidate, and can you do it at scale?
Yeah, no, that's really great advice, and I think this is probably something that I would recommend that sort of everyone does is talk to your team, figure out what the pain points are, figure out kind of what you're trying to solve, and then stick with that. Don't ignore it. Write it down, and then go down the list when you're talking to Rectangle Health, other vendors, and figure out, do they actually do it? Because
that's right.
That's not always the case. And to your point, I think as you're at a stage where you're growing, and you're going from 2 to 5 to 7 to 10 to 15, you've got to have vendors and partners that can grow with you.
That's right.
On all fronts. And whether it's on the HR side or it's on the patient payment side or on the marketing side or other things, I mean, you've got to have all that. So, okay, Brian, my favorite question, because I feel like this is where, we get a lot of, bang for our buck. What's the one mistake that DSOs and groups make when incorporating new technology? Okay, so now they've decided on a vendor, right? They've made their payments, they're ready to rock and roll. What's the one mistake that you see that you would, recommend the DSOs and groups think about and to avoid?
Great question. I think it's actually pretty easy to answer. It's lack of top-down communication. The top of an organization, the owner, the doctor, the CFO, the COO, whomever, is going to like the software, no doubt, and they're going to negotiate a great price. But if you don't get the staff, the users buy-in, whether that's the OMs, the regionals, or just the day in, day out FTEs at the front desk, if they are not involved in the process, it will not go over smoothly, because I've been here for 20 years. I don't do that. The vendor needs to win them over. I'll be honest, winning over a COO about how we're going to eliminate billing and get you paid faster, et cetera, that's fairly simple. We need to go win over the user. So what we do at Rectangle Health is always, we'll meet at the C-level, but the second demo we do, we insist on the users being involved. Because if we don't have their buy-in, we will never succeed as a partner to that organization. So that top-down communication is critical when installing new technology. It's absolutely critical.
Yeah, I love that. I love that. And, from a leadership perspective, guys, this is a huge point. Brian, I'm glad you brought it up, because you're exactly right. We see it too at HR for Health, where, the C-level folks are concerned about liability. They're concerned about, documentation. They're concerned about all the legal things that, let's say, that comes with, HR, and they want to bring us on board, but they haven't communicated that to the team.
Right.
So now you've got this HR manager who thinks they're going after her job, and it's like, no. Like we talked about earlier, we're trying to save your job. More importantly, we're trying to make your job more fun by getting rid of all the paperwork and all that stuff. And you're exactly right. It's all about communication. And I think too that, if it's communicated as part of a growth plan, right? If it's communicated as part of how do we make our team stronger and our business stronger so we can all thrive, which is usually the case with technology. I mean, that's why we incorporate it. There is going to be buy-in. There is going to be buy-in. It's when people, I think, are surprised that they get defensive because change is hard, and everyone's like, I don't know if I want to do this, because what if I'm not good at that? And what if Rectangle Health runs on DOS and I don't know how to run DOS? I know you don't run on DOS, but actually I don't even know if the audience even knows what DOS is anymore. but it's the whole idea is, I think the whole idea is just communicate so that you have the team on board. So great advice.
Yeah.
So Jennifer, any questions? Have we got any questions from our audience?
Yeah, we have two. So Brian, they are for you, if you don't mind. Okay, so how much time can be saved through automation of tasks, and what are some averages you're seeing? The first question.
Great question. So we actually had a third party come in and audit our dental portfolio, because this is something we get asked for all the time. Hey, this technology sounds awesome, but what is the ROI? What are we actually going to get from this? So we found there's a number of cool statistics. I'll kind of talk about the big three that I like. First is reduction of AR. We saw by up to 25% by implementing technology. So when we think about AR, whether it's 30, 60, 90, 120, implementing technology will decrease that by 25%.
That's huge.
It's huge. It's massive. Yeah, it's absolutely game changing. With that comes probably this one's a little harder to quantify, but it's calls to the practice reduced by up to 30%. Because if we're automating a lot of this via text, via email, via card on file, via e-statement, the calls to the practice don't happen anymore. Because, I got a text. Yeah, I owe you $65. Pay. So those two kind of go hand in hand. And then the other one that we find absolutely fascinating is collection rate at the time of treatment increased by anywhere from 5 to 13%. So not only are we collecting more in the clinic, we're reducing the back end work and getting everyone paid faster, and the patient satisfaction is increasing because they're not calling in anymore. They don't have to call in, they're paying via technology. So reduction of AR, reduction of calls to the practice, increase of patient payments at the time of treatment.
And and I'm sure people are making these connections, but just to kind of summarize, those three statistics are really interesting, Brian, because it has a direct impact on the value of the business, right? Because
yes.
what are DSOs and groups valued at? They're valued on cash flow, on receivables, not on production, but on receivables, right? And so so if you are getting in more money more quickly, I mean, that's incredible. If you're not hiring people just to answer phones and text messages and whatnot, you're saving money on that front, on the human side, and they're focusing on probably other things that are better. And so, yeah, that's incredible. You're saving them money on all fronts and increasing their value.
It's directly to the bottom line, and it goes directly to their evaluation. I mean, that's awesome. Especially with growing groups, it's powerful.
Yeah, that's great.
Okay, so the other question here is, someone sees that Rectangle Health can now help with HIPAA and OSHA compliance. It's challenging to keep up with these requirements. So how can Rectangle for Health help? Lots of H's in there.
Yeah, great question. So software again. So basically what we've done is we offer a couple compliance solutions for our practices that basically manage all aspects of HIPAA, OSHA, PCI, all the policies, procedures, business agreements, emergency planning, trainings, the big handbook. It's all done via software now. It's all centralized into a gateway, for lack of a better term, and helps the practice go up market or down market. So when we do have a lot of FTE turnover, the training, the HIPAA, the OSHA certs, that's all done via software now. So the HR team can simply go into the software and say, hey, all these people were trained, these two people have left over, and we can concentrate on those other two. It also includes things like cybersecurity and email encryption and data backup, et cetera. So it is designed to streamline the staffing turnover and training for the practice on a monthly, annual basis.
Awesome.
Thank
you guys both so much for your input. That was awesome to listen to. I appreciate it. Any last words from either of you? Have a good day.
I wrote a whole bunch of things down for sure, but I think the message is, use technology, help your practice become more efficient, more profitable, incorporate that by communicating with your team. And for those of you who haven't, used a system like Rectangle Health, I would suggest you reach out, get a demo, talk to the team. Just it doesn't hurt to have a conversation. We always say that about HR for Health too, Brian. I always say, it may not be a good fit, but have a conversation and see what they can do. And if it's a good solution, if it's a good fit, great. If it's not, we part as friends. But the idea is, we've all built these companies with the idea of making the offices more profitable, more efficient,
right.
And so that's great. Brian, how do they reach your team?
Yeah, you can go to our website. You can fill out a form there, or you can reach me directly. My email is simply bdoyle@rectanglehealth.com. I'm pretty accessible, so if you need anything, feel free to go to our website or reach out to me directly.
Man, that is not fair. I always have to spell my last name in all my emails and stuff. bdoyle@rectangle. How much easier does that get?
I know. It's so simple. bdoyle@rectangle.
My name just to make it easy.
Absolutely right.
All right. Well, thank you, Brian. Thank you, Jennifer.
It was my pleasure. Thank you for having me.
Have a wonderful day.
Thank you.
Bye.
Bye.